What we do here matters, because what we don't do matters even more.
We need to continue to push, and we at ADAO are going to continue to push the Surgeon General of the United States.
As you know, the United States continues to use asbestos, and that indeed is a barrier to others stopping its use.
The most horrific part of this whole story is that it is preventable.
We are very privileged today to have a keynote speaker that I've worked with for many, many years, Dr. Aubrey Miller, otherwise known as Captain Aubrey Miller, because he's a uniformed commissioned officer in the United States Public Health Service, where I spent my career, so that explains his uniform. Just for you that have never heard of the Public Health Service, we're one of the 7 uniformed services of the United States. We don't carry weapons because we fight disease and epidemics. And we've been in existence since 1798, basically. So we're a very old sea service. That's why the uniform looks like the Navy uniform, because we are a sea service and provide medical care for the Coast Guard, federal penitentiaries, staff the National Institutes of Health, the Centers for Disease Control, and other agencies. So I would like to introduce you to Dr. Aubrey Miller. We first met when he worked with me at the National Institute for Occupational Safety and Health. And Dr. Miller has a very distinguished career in public health and has worked in the Secretary of Health's office, the Surgeon General's office. He's now with the National Institute of Environmental Health Sciences, which is a picture of it located at Research Triangle in North Carolina. However, he is located here in Washington, D.C. as a representative to their office here. I would like to have all of you read more about Dr. Miller, and I'm not going to spend a lot more time on this issue, but there is a write-up, a nice write-up in the program about Dr. Miller and his work. Some of his latest work on asbestos, by the way, has been with Dr. Black and others in Libby, Montana. He has also been to Turkey more recently and looking at the area night situation. And with that, I will introduce Dr. Miller. Before we start, I would like to present, as our keynote speaker, our appreciation for Dr. Miller. I'll get it straight, it was backwards. For taking the time out of his schedule and to take a weekend and come with us for our meeting today and to make the keynote presentation. So our appreciation for your participation in our meeting. And I might say Dr. Miller has been working with ADAO for many years, so this is not something that is the first time for him. He's worked with many of us in this organization, and we thank you for taking the time to come.
Doesn't cut into your keynote. That was lovely.
And thank you very much, Admiral. As Dr. Lemon was an Admiral of Public Health Service and distinguished one with that, and I certainly had the privilege of starting my career working under the tutelage of fine scientists and researchers and public health officials like Dr. Lemon. First off, I want to start by thanking ADAO for having me. I am truly humbled and inspired and gratified by having this opportunity to be here with you. That's something that is incredibly important to me, and also having had a career to work on public health issues like asbestos that are important to people, and I have an opportunity to work on important public health situations like Libby, Montana, which I started at a point, I guess, of and to be able to realize the magnitude of the situation, and we'll talk a little bit more about that. But again, the importance of ADAO in motivating and underpinning the work by government health officials and others is incredibly valuable. And folks may not realize it, but to be able to connect with people outside of the government and understand the meaning and utility and importance of work that we do is genuinely and valuously appreciated and incredibly important to us. So thank you again for having me here. We're going to talk a little bit about asbestos in the environment and the workplace. And that interface is one that it really needs to be kind of thought about and understood. So I'm going to take Arthur's even further back, because asbestos actually goes back to like 50 AD when Pliny the Elder talked about asbestos, and he mentioned it in terms of workers that were getting sick. So Pliny the Elder was a naturalist, and he wrote this whole encyclopedia of natural history, and it was called Asbestos, which meant unquenchable. Workers had many health problems and died at a young age, as was explained in there. As Arthur mentioned, 1906 was first reported case. 1924 was actually an article written by William Cook, who talked about a woman who died at age 37 of asbestosis. So clearly we knew about asbestos. And we knew about asbestos, and a number of articles came out up into the 1960s when Dr. Selikoff started looking at insulation workers in Paterson, New Jersey. And a series of articles came out talking about asbestosis and lung cancer and mesothelioma. And the connections were made, the smoking connections were made. And we certainly knew that asbestos was causing great harm, and we've known it in many respects for well over 100 years. The environmental linkages were also made in the 1960s too, and not well understood and not well appreciated, and certainly not talked about to the degree that the worker issues were. But they also noticed that people that lived around mines or had household members that worked in asbestos trades were also getting sick and had pleural disease and pleural plaques. They began to see asbestos bodies, asbestos fibers that were coated with cells in people's lungs that live in asbestos fabrication areas, as well as noting in 1960 by Wagner, who noticed that the mesotheliomas were very high in South Africa, and that a number of people didn't work in the asbestos industry, but they were just either family members or lived close by. We've had a long history of asbestos. In 1970, OSHA and EPA were actually founded. They began right away working, actually OSHA did work on asbestos. It's one of their first acts. So we realized asbestos was a problem, started working on asbestos. And in 1971, just a year after OSHA was developed, they started to actually start to regulate asbestos in this country. 12 fibers per cc. By 1972, it dropped to 5 fibers per cc. And we'll talk a little bit about what the fibers per cc are. As a matter of fact, EPA got into the act pretty quickly by 73, and they actually was talking about asbestos in materials. And they have what's called the asbestos-containing materials. How much asbestos can be in a product? How much asbestos can be in a material? Consumer Product Safety Commission, CPSC, was established in 1972, got involved as well. And they did work on hair dryers and patching compounds. And by 1986, OSHA got back going again, and they dropped the exposures to 0.1 fibers per cc. EPA has what's called IRIS, which is their community-based levels of exposure that they let people in the environment be exposed to, and they made regulations, and also school regulations. What are we going to do about schools and all this asbestos that remained in the schools? And we moved onward from 1986, and there's not a lot of activity. Libby, Montana came to being in about 1999, 2000 at the beginning. And my career as an occupational physician, environmental physician, and we had done some training in asbestos, and I had done some work in Chicago, Cook County, on asbestos workers, but never really spent much time beyond that up until Libby, Montana. So we had built the rules. We were figuring it out. There was a lot of information about asbestos and disease. Dr. Selikoff and others had done an amazing amount of work and brought it to the attention. And there was all sorts of rules and regulations in place. So what's the problem? What did we build? How effective is it? How good is our public health coming out of it? What are we left with? That was my three little pigs. The house was made of straw. Libby, Montana. And Libby serves as a great case study, and Libby's not the only place, certainly in the world, but Libby is a great case study, not only for what happened in the United States and for us to realize that our house was made of straw, is the fact that it hits on so many points. So Libby, Montana was a work site. It was also a community. It's also a place where they made a product that was shipped, not only in the United States, but elsewhere. So the article came out by Andrew Schneider in 1999 in November and reported at least 192 people dead, 375 people diagnosed with fatal diseases caused by asbestos in vermiculite R in this little town of Libby, Montana. And I was working with the Environmental Protection Agency at the time, and we had this call about this article. And our first response was, no way. There's just no way you can have a problem in 1999 of this magnitude, especially with non-workers, that the public health community did not see. How could that happen? This is 1999. How could that happen? You can have this much illness and not see it? And if it was in New York, would we have seen it? Maybe, probably. In Libby, Montana, we didn't. So we thought it would be actually a quick trip to Libby, Montana, and that it would be put this story to rest, that this reporter had it wrong, and actually he had just hit the tip of the iceberg. So Libby, Montana was the worst site, and has become the worst site in terms of health in EPA history of all the sites that EPA's dealt with. And people have heard of Love Canal, and Times Beach, and all these other places. This is the worst in terms of human health. It was actually declared a public health emergency, and it's the first site declared a public health emergency by EPA, and also in combination with the Department of Health and Human Services. And they said, the first time EPA has made such a determination under CERCLA, which is the Superfund Act, that conditions at a site constitute a public health emergency. The determination recognizes the serious impact to the public health from contamination at Libby and underscores the need for further action in healthcare for area residents who have or may be exposed to asbestos. It's also written into the Affordable Care Act by Senator Max Baucus, who was helpful in including Libby because of the recognition that it needs special attention. So let's talk a little bit about what we saw in Libby. Clearly when we got there, there were still mounds of vermiculite around town, and a lot of the old operations were still there. We quickly went into two phases. One was an environmental phase to try to understand what's there and what do we understand about it. And actually it goes back a ways to when actually Dr. Lemon was still at NIOSH, is that NIOSH was working on the worker side, and others were working on the worker side. They actually went up to the mine and they did studies in the late 1970s, early 1980s, and EPA also went out there to look at some of these issues. And they began to understand that the workers were highly exposed, as were many places across the United States. And they made studies and recommendations and thought things had gone pretty much quietly back into its place. And that was in the early 1980s, and it kind of all went away and disappeared. So now we go back to Libby in 1999-2000, and we're like, well, we know the workers were sick, but we're talking now about, and this article talks about, not the workers, the community. And what do we really know about non-work exposures? These exposures, these low-dose exposures that aren't supposed to get people sick, only those high workplace exposures are going to get people sick, right? That's what our laws are meant to do, is to keep those high exposures and make people sick away, and not worry about those low-dose ones because people are okay with that. Well, we undertook a screening. Federal agencies put together a screening of the town within 6 months with Dr. Black and others. And we actually, first round was about 6,000. We came back the next summer, did another 1,300 people. And we found that about 18 to 20% of the population in Libby had pleural disease. Had findings on x-rays that they had been exposed to asbestos and was resulting in scarring of their lungs. They also had elevated lung cancers. They also had high numbers of mesothelioma. As a matter of fact, one of the cases, it was a sentinel case that we had talked about earlier, is a woman whose husband had worked at the mine, and she died of asbestosis, which is that scarring of the inside of the lung. This is not a worker who died of asbestosis. This was a household member who died of asbestosis. Asbestosis is one of those diseases that we always termed in my medical education that real high dose exposure. You had to be a worker in real high exposures, and thank God we don't have that anymore. This was a household person. How much dust can an individual bring home on his clothes each day to equal a workplace exposure to result in somebody dying of asbestosis? Shocking. Not only was Libby important for Libby, but Libby made the mine in Libby made vermiculite. Vermiculite was shipped. This was the world's largest vermiculite mine. So 80% of all the vermiculite in the world was produced at this Libby mine. And it was shipped around the country to about 300 processing facilities in the United States. There's just a little, those circles represent, the size of the circles represent how much shipments they were getting. But you could see all the number of various places. As a matter of fact, Dr. Black showed this picture a minute ago with these kids playing. That's actually in Minneapolis, Minnesota. This is a mound in a residential neighborhood in Minneapolis, Minnesota, and this was actually a case that was written about in 1994. It was just happened to be in an article which talked about one of these individuals who died at age 42 of lung cancer, but also when they looked at his lungs, he had asbestosis. And they go, he had fibrous changes in his lungs. And he had these fibers that they looked at and they said, wow, it's tremolite. And they talked about this vermiculite maybe being the cause of it in this article. And it became a sentinel article and really important to this quest of understanding that not only was it in Libby, but it was being shipped around. This was a neighborhood, and these kids only lived there for a couple of years and played on this pile occasionally. Vermiculite attic insulation in millions of U.S. homes. Dr. Millett, sitting here, actually did a really nice study looking at some of the exposures in that, and we'll come back to talking about exposures from some of the products. But here's vermiculite attic insulation. So not only was it shipped and processed in places, but now you have a product that was placed in millions of homes, not unlike other asbestos products. So I find myself in thinking about this discussion today about, well, we knew all about some of these things. As a matter of fact, we knew about this well before the Libby situation in many respects. How does this happen? How could this happen? Is it a lack of enforcement, a lack of warning? We knew about it. How could this happen? Was there a lack of that? Well, certainly in the 1950s, the state of Montana was doing inspections of the Libby mine and actually had recorded that about 40% of the dust and the emissions within the factory there, the mine site, was asbestos. And they were saying, hey, it's too high. Even we get this, and they're warning at that time the company to say, fix this, start bringing it down. And even as late as 1964, then when they went back, they said it still hadn't changed in their internal memos to the company. It just wasn't reported to the workers. It was ongoing. So this toxic exposure not only, but is this different than other toxic exposures? Let's hold this thought for a second. So not warning people working in companies about toxic exposures isn't unique to asbestos. And it certainly happened with other things like lead. So let's compare lead to asbestos for just a moment. This is something that I dwell about because it kind of perplexes me to some extent. Why is asbestos different? Both materials are widespread products in materials in the environment. They're both natural. Lead is a natural, oops, let me try to get this back. Thank you. Lead is a natural element. Mineral fibers are natural elements. They both have toxic properties. They both cause adverse health problems. I should be there. Okay, now I'm in the right spot. Lead causes, I looked up one thing quickly, about 200 deaths in the last 20 years, 1979, 1998. Has a very good public perception about lead. People are on it. Parents are worried about kids' exposures, are worried about soil exposures. It's been eliminated from soil, not from soil, but from paints and gasoline. We have a very active surveillance program around the country looking for lead in kids. There's continual research on safe levels. As a matter of fact, CDC, based on studies, is going to reduce the recommended exposures and allowance for kids and amount you could have of lead in your bloodstream. And these are based on studies of performance on what's called neurocognitive testing, how kids perform on tests. So you do epidemiologic studies and you look at this group and you say, this group, the ones that have higher lead don't do as well. We're going to work toward making safe levels. The medical community is open and aware and engaged in the lead issues. Asbestos. Well, I'm giving you 6 years. We've had 18,000 deaths in the United States in 6 years' time. Much higher. And that's not including asbestosis. That's just mesotheliomas, the straight ones that we know are pretty much asbestos-related. Poor public understanding of the exposures and risks. They really don't get what's in their homes. Attic insulation is still pretty common to just a website on a government page. Very poor understanding about materials and risks in their environment. Even if you lived in a place that has very high asbestos minerals in your soils and environment, people don't get that, but they do get it about lead. Little research on safe levels, really since the 1980s. Medical community is not engaged, per se. I had a discussion recently in New York with at a hospital to talk about to the physicians about asbestos. Isn't it banned? I thought it was gone. It's not a problem anymore. Why are we even talking about this? Many think it's banned. So why isn't the process working? And working for asbestos? We continue to see ongoing disease in workers in the community, similar with other substances like lead. Is it the latency? And maybe. It certainly plays a role. So the latency being the time from when you're exposed to the time you start to show effects. And for asbestos, it takes many years. So with lead, I can measure it in your bloodstream a lot quicker. But certainly, I can see disease of asbestos in people. One conversation I had with Dr. Whitehouse, Alan Whitehouse was a good friend, but he was also one of the first ones to be working in the Libby site, and he was actually seeing patients that were coming to Spokane to see him about their disease. And he was seeing a lot of folks that were coming from Libby. And I asked him, when we started the investigations in 1999, well, how come you didn't report all this? And you were seeing these people, even ones that were not workers. And he goes, well, the mine was closed. The mine closed in 1990, and I figured it wasn't a problem anymore, that what I'm seeing now is just people that had exposures from those high exposures from days gone by. Certainly, asbestos is surrounded with financial interests and political issues. There's a socio-legal surrounding of asbestos that doesn't seem to envelop some of the other substances and toxic substances that we're exposed to. And this is a real problem because it keeps us from getting to the root of the issues of what we need to do, the regulations we need to make, and the protections we need to advocate on behalf of public health. There's a serious adherence to dogma with asbestos that I don't understand entirely. As a scientist in the public health, you should always be looking to understand what it is about a substance that causes it to create disease and how to protect people from it. There's still this dogma about it's only a problem in workers, and this is from the medical community. You need those high-dose, long-term exposures. From the 1960s, we already knew that exposures were happening in people that were just household contacts. Mesothelioma cases in people that lived around an area, those aren't high-dose exposures. Low-level contamination, not a problem. It's been in the literature for years. Science issues. Let's talk a little about science issues. So unlike lead, which we know what it is, PB, it's an element. It's on the periodic table. Asbestos is not on the periodic table. Asbestos, as was mentioned earlier today, is a commercial designation. So if we think about it, there were mines of these fibers around the world. We find these fibers and we say, oh, we can do stuff with these fibers. We can make products out of these fibers. These fibers varied from where you were in the different mines, but heck, we'll build stuff with these fibers. So those became the fibers that were used by industry and commercially. And we began to understand as they used those fibers that people were getting sick from those fibers. So it's really a collection of these fibers. So there's really 6 regulated forms, and that's based on the fibers that were used. The predominant fiber that was used is called chrysotal. It's part of this serpentine family of silicates. Most of the earth is made of silicates. The serpentine family of silicates contains one fiber that was mostly used for manufacturing called chrysotal, about 90%. Here's a picture of textile manufacturing. The amphiboles were also used, predominantly crucidolite and amosite, a little bit of anthophyllite, not so much. These last two weren't really used very much and really more of a contaminant of some of the other mining processes. And Libby, Montana, what we see there is falls closer to those two. But that's actinolite, tremolite. So we're based on 6 commercial designations, essentially, of what's regulated. And it's regulated by its mineralogy, so that's the chemistry of the fiber. And it's also regulated by the size and the shape. And I'll tell you why this is important. Because what you measure is what you count, and what you count is what you report. And what you report becomes what's regulated. It becomes what the law is. It becomes what we try to protect people from. It becomes the basis of our understanding what's safe. It becomes the basis for understanding of the health effects that I measure. So I really need to understand what it is that somebody's exposed to in order to figure out what's going to happen, what I see as a health effect, and how to protect them. So let's start with where we began. We began with an optical microscope, and that's what was used in the early days. Was you would look in this microscope at a factory, and you would look under the microscope and you'd see fibers. This microscope didn't do a great job of telling you that the fiber was a cat hair or an asbestos fiber or a piece of wood fiber. But if you're in an asbestos factory, you can lo and behold be sure that most of those fibers that you're looking at under this optical microscope is asbestos. And so it was used for that, and it became a pretty good tool. And it was really a tool created for the workplace where it was being manufactured. So under the optical microscope, you can get closer to this, which is about 12 times. You go all the way up to what's called electron microscopy, which Sean and others here utilizes their tools, which really tell you and see these fibers. As a matter of fact, under an optical microscope, what you see here, which is a bundle of Libby fibers, would be counted essentially as one fiber. Well, under a TE microscope, you can see there's thousands, if not hundreds of thousands of fibers here. So what are we doing? The optical microscope and this methodology that's used for our laws, for everything else, was really meant for a different purpose. And we've stuck to this. We've locked ourselves into it. So the current rules, we'll talk about the rules in just a second. The current rules assume that cancer, which is very important, is the most important health endpoint. So when I make a law and I tell you how many fibers you can be exposed to in the United States and predominantly around the world, I'm basing it on your risk for cancer. That may not always be true. Oops. It may not always be true. The size and shape, the current rules don't say, well, the size of these fibers are very important. We're just going to count them. All the ones that are the ones that we actually capture are the ones, there's no difference really. And the ones we capture are not any different than other ones in a sense. I'll speak to that a little bit, but this issue about the size and shape of fibers is very important to understand. It's a bit complex, but if you're looking at these fibers in a microscope, you see all sorts of stuff. But you're only going to count certain fibers. You're only going to include certain fibers in our definition of asbestos. Dr. Lemon actually testified on this particular issue in 1990 before Congress, saying that the size and shape of these fibers is really important. We need to understand this. And that it may be, and probably is, the thing that causes people to get sick. Not the fact that it's chrysotile or actinolite or tremolite, but it's just something about the nature and the characteristic of the fiber. The 6 commercial designations are sufficient, as the rules say. Those 6 ones, that's all we're going to worry about. That's what we're capturing. And we have chemistry and information about those fibers, and that's what we're going to use. It's just basic and kind of very vague, some of this in terms of the determination and definitions that are used. And another piece, remember in, I think it was 73 or 83, when EPA talked about asbestos-containing materials, they did it at 1%. That materials below 1% are not listed. Any products that have below 1% are not listed as asbestos-containing. They can have less than 1% in it of asbestos by weight. However, you don't have to call it as asbestos-containing when it's below 1%. So they basically, the assumption is, well, there's just a little bit of asbestos in that product, or a little bit of asbestos in soil, or a little bit of asbestos in vermiculated attic insulation, less than 1%. It's not a problem. And that was the assumption. Okay, here's the rules. The game rules for the game. So OSHA worker regulations work off of this rule for the most part, is that if you're working in an area that has asbestos as you're a worker, you're allowed to be exposed up to 0.1 fibers per cubic centimeter of air. That would be equivalent to 100,000 fibers in a meter of air. So if I took a big meter box and I filled it up with 100,000 fibers, that would be the limit that you could be exposed to, the action limit. And that equates to, if you're exposed to that as a worker or just below that, about almost 3.5 excess deaths per 1,000 people, which is a pretty high rate of illness, of acceptable rate of illness. When we talk about communities, and EPA talks about, well, maybe 1 in a million is acceptable. But for workers, about 3 per 1,000 to get sick, and especially cancer sick. OSHA states that it's really not protective. They know it. They've been trying to change it, but it is what it is. EPA's public guidance is called Integrated Risk Information System. It was promulgated in 1986. And they take a risk of about, excess risk of about 1 in 10,000. And this is much lower if you look here, because it's 0.00004 fibers per cc. Much lower number of fibers. Now, new to Libby, and Libby specific, EPA has been looking at this exposure saying, wow, we're seeing, as Brad was talking about earlier, we're seeing this pleural disease, and we've been studying another site in Ohio where workers were dealing with the Libby product, and we're seeing that these folks were getting pleural disease at levels that appear to be an order of magnitude lower than what we assume is protective for cancer. And the general assumption for all of our regulations are if you protect from cancer, you're protecting from all the other stuff. You know, we got you, you're safe. But here, this looks like the actual more sensitive health effect, maybe pleural disease. And for Libby at least, and for these exposures in Libby, that's something different about this fiber, maybe more toxic. Let's talk a little bit about the asbestos loopholes. So in the red, if I had a whole box filled with fiber, we're only going to count fibers of a certain size. Let me see if I can actually show you where the size was talked about. We're only going to count fibers of a certain size. There it means, without getting into too much detail, 5 microns in length, greater than 0.25 microns in width. It has to be a certain size, length, and shape. So even though I have a whole box, or I can have it on my filter and I'm looking under that microscope, that optical microscope, and there's stuff there. There's stuff I can't see. That microscope's not so good. I'm only going to count fibers of a certain size. And that's what's that red circle. So if you take the microscope that Sean and Jim Millette use here, you can see under TEM, this big blue circle, all sorts of fibers there. You could see short ones, which is most of what you're exposed to, not these 5 microns and longer. You can actually see very thin ones and very thin long fibers. And the evidence from studies show that those fibers are pretty important. You can also see fibers that aren't even counted under our rules, because we only count the 6. So if Aryonite's there, not going to count that. It's not regulated. Not there. A new issue now is getting into nanofibers. We're learning that these whole new nanomaterials. Fibers are in these ranges. We'll come back to the other boxes soon. So you only count what you see is in the red. The rest of it's there, but we're not counting it. Okay. So for Libby, we'll start just for a minute and talk about the mineralogy, the chemistry, the name. Tremolite, the one box in the corner in the bottom left. That's the one that's regulated. But if you take the sodium atoms and you add a couple there, and you have some different elements here and here, just a little bit of nudging, and wow, you're in a different name. It's called winchite over here, and called richterite up here. And so in Libby, we saw 85% winchite and 10% richterite. And by the way, when these regulations were created, back when, and you're looking under an optical microscope, it was all tremolite. And now we have an argument, legal arguments, court arguments. Well, the company goes, I don't have to report any of this stuff, because the mineralogists got together and they changed the names. And this is all we're going to follow. So the tremolite, that's why the names are very important. Because if you're looking for something and you're going to talk about asbestos and you're going to protect people from it, and all of a sudden I don't have to call it asbestos, I'm not going to report it. I don't have to protect you from it because I don't have to deal with it. All right, the size of the fibers. In Libby, we see only about 50% of the fibers, if I have my filter, are going to be ones that actually fit in the ones that I count. Why is this important? Because the current science indicates, as Dr. Lemon testified to, the current science indicates that shorter and thinner fibers are important. They cause people to get sick. They cause illness. And when we had the World Trade Center, the picture's missing, EPA actually, in recognition of that, am I done with my time? I've got to move along. EPA, in recognition of that, actually counted the thin fibers. They counted ones that you're not supposed to, typically under the law, because they knew it was important. All right, now there is a picture. Okay, let's talk to another. You don't count these fibers in the center. Well, let me reframe that. There's a whole other issue of the asbestos loophole. So I'm supposed to count all the ones in the red, but the ones in the center, there's another out for people looking under a microscope. They can say, well, some of these fibers don't look like the ones that are commercial fibers. They look like fibers that were created in the mine, or have a different look, that they're called fragments. They broke off from a piece of rock, and they look like a fiber, but they weren't born the same way. They weren't born in long, thin fibers. They broke off and became them. And so they don't count those either. And the reason why this is important, and I'll give you, when we get to mines like Libby or Silver Bay, which is a taconite mine in Minnesota, or Death Valley, California, which is a talc mine, the companies say, well, I don't have asbestos fibers here, they're all these cleavage fabric. Even though they fit the, I'm supposed to report them, they got the right size, I'm not going to report these because they're cleavage fragments. I can look under my microscope and tell you that they're cleavage fragments. And actually in Libby, the company said early on, hey, it's all cleavage fragments. Well, if they're all cleavage fragments, then heck, we should be regulating cleavage fragments because they're really harmful. Or, you know what you're talking about. And when we actually asked them, and USGS looked closely at it, and they couldn't prove that they were cleavage fragments. So it's a whole different thing. Let's go quickly through asbestos in soils and products. We know that these low concentrations, let me emphasize that this below 1% was made because of the microscope's ability to see it, not because it was a health issue, can generate very high levels of exposure. It's really important to get this for our soils and communities and products. So here's Libby vermiculite, attic insulation. This gentleman had put insulation into his attic from age 17 with his parent, his father. He lived in that house, went up and down to the attic pretty frequently, ended up developing a mesothelioma. We couldn't find any other reason for him having asbestos exposure. Dr. Millett and others had done a study, this is that, where they went into attics in vermiculite and found levels that are, you know, the level is 0.1 for a worker, 0.004 for a non-worker. So look at these levels, are 100 times higher for these exposures. Same for products and contaminations in materials and products. ADAO did an interesting study, and thankfully somebody's looking at these products. But ADAO did a study where they looked at about 200 products, and they found about 10% of them, 17, had asbestos in them, including a kid's game, and it had talc, contaminated with asbestos. Now another big thing that we're moving into is demolitions. They want to tear down buildings, get away from what's called the regulations for taking out all the asbestos. But if I take a water hose and try to just put the water on the building and tear down a building, we know from our work that it's going to release a lot of fibers. We need to be looking at this. Contaminated soils, we did work when I was with EPA. We just went around, this is El Dorado, California. There's other places all around the country. There's about 100 places that have aragonite around the United States as well, where if you just ride your bike, play outside, you're able to generate pretty good exposures. The aragonite, as was mentioned by Dr. Demers, we looked in Turkey, and the problem with aragonite, it's a fiber, it's not regulated, it's another fiber, it looks like asbestos under a microscope. It has a little different chemistry. But in these villages in Turkey, almost 30 to 50% of the adults living there die from mesothelioma. There's nothing I've ever heard of in any exposure to an environmental agent where it has that kind of rates of fatality and disease. It's amazing. So we went to North Dakota where they were actually using it, unbeknownst to the county and folks, because it's in gravel there, just naturally occurring, using it on roads, 300 miles of roads, about 30 miles of school bus roads. We went and looked inside the school buses, and lo and behold, flying around inside the school buses is these fibers. And at levels that would be of concern. If it was asbestos, we might want to regulate that. So the international ban and the ban in the United States, incredibly important, incredibly meaningful. But we also have to make sure that when you ban something, they're actually banning what you want to achieve. You have to be looking at contamination below this 1%. You have to make sure that if I say, I don't want any products, and they say, okay, we're not going to send you any more asbestos products, but we're going to send you products that have below 1%, you didn't really ban it. And that was the problem with the ban that was attempted a few years back. This issue was that under that ban, the vermiculite attic insulation that's in millions of US homes would not be banned because it's below 1%. Though I can get it into your attic and generate exposures for you, the homeowner, or the person who goes up there to put cable or electric cables in there, that'll be way over the top. So it's not an effective ban if you're not banning what you intend to do. We won't spend time on that, on the newer health effects. Some of that was mentioned, but the research goes on. Phil Cook has been talking about we need to really look between these two questions. What factors make a fiber harmful, and what exposure levels are safe and will cause harm? Are kids more susceptible? We see in communities. What about people with other medical conditions? What about genetics? Is it playing a role? Other markers of exposure, prevention of disease, and some of that was talked about this morning. So what we need to do, my last slide, and I'll wrap up. So we certainly need to be thinking about these loopholes. We can't just accept that these regulations and what we talk about with asbestos blindly. We need to understand some of these fundamental issues which lie behind it, because we're not going to cure the problem unless we do. It's fine to advocate, and we all need to advocate on behalf of reducing asbestos everywhere we can, but we also need to understand what it is we're trying to achieve. And what we're trying to achieve is elimination of these harmful fibers, whether it's asbestos, erionite, nanofibers, everything else that's going to look like this and cause disease. We need to be on it and move ahead and not wait until another epidemic breaks out, or pandemic in this case. Also, I really wanted to just give another shout out really for ADAO and advocacy here, because the incredible importance that advocacy and organizations like this serve in providing oversight for the government and important input to the government, and the ability to do the science that even you did, the ADAO did in testing products, how incredibly important that is. It's not being done. No one's looking at these products. They looked at 210%, and these were from Walmart and Kmart and big places. 10% of those products had asbestos in it. People don't know that. Consumer Product Safety Commission's not looking at it. EPA is not looking at it. I'm not aware of anybody looking at it. It's really important for citizens to come together, whether here, internationally, those that are watching this, to really band together and start looking at things. Don't wait for government to be the ones that do that. And also, I had a chance, and Brad and I had a chance to be with Steve Levin just shortly before he died, and his last words were just, don't give up, don't be deterred, just focus on it and focus on this important public health issues, this and others, and do the best you can. And I just want to thank you, all of you, just with a short quote that I appreciate. Thank you so much for your time. I appreciate it. I'm sorry.